So how do we begin to talk about this at a national level? And we asked our closing speaker to address some of the issues of health disparities. She's worked in this field for most of her, a lot of her career. It is my pleasure. I'm going to ask you to please take a seat. It is really my pleasure to introduce our next speaker. Dr. Gina Thornton-Evans has a distinguished career at the Centers of Disease Control and Prevention. She's the lead on Healthy People 2020 and 2030 activities related to oral health. And she's the topic agency lead for those activities. She is currently developing oral health objectives for Healthy People 2030, so this will be a great discussion to have with her about equity. Dr. Thornton-Evans oversees the oral health component of the NHANES survey, and she also, in her spare time, she directs the Dental Public Health Residency Program at the CDC. Dr. Thornton-Evans will talk today about Healthy People 2020 and beyond, new directions. She's very knowledgeable about the subject. I'm so excited that she could join us today. A friend and colleague of mine, Dr. Gina Thornton-Evans.
Thank you.
Can I help you?
Well, good afternoon, everyone. I think you can hear me okay? Okay. Thank you, Dr. Capelli, for inviting me to come and present to this group. This is actually my first time being at this meeting, and I must say that I've been so impressed, so empowered in terms of just the content and the level of the conversation. Very, very impressive meeting, and I thank Dr. Capelli for all that he's done with respect to this colloquium and all the work that Annalise has done. She's very patient with me, and as Dr. Capelli alluded to, I do wear quite a few hats, and sometimes it gets a little confusing when you have to travel almost every week, that is in the month of January. So I'm going to get started here. So basically today, as Dr. Capelli mentioned, I'm going to talk a little bit about Healthy People 2020. Those are our current objectives and some of the processes that we've been using for Healthy People 2030. I also will give a historical context of Healthy People, just why is this initiative important? You know, what were the mandates for it? And then I'll go into the data sources for Healthy People 2030. That's the area that I'm really quite passionate about. And I'll talk a little bit more about that and why that's important to me in particular. This slide just shows the other individuals that work with me from the federal level with respect to Healthy People 2020. And actually, most of these have been involved in Healthy People from Healthy People 2010, and now moving on into Healthy People 2030. We have Dr. Tim Iafola from NIDCR, Dr. Renee Joskow from HRSA, and then Rear Admiral Timothy Ricks from IHS. And also just to acknowledge some of the past co-leads, some of you probably are familiar with these individuals, Dr. Stuart Lockwood, Dr. Alice Horowitz, Dr. Candace Jones, and Dr. Jay Anderson are essentially our predecessors with respect to Healthy People. So why is this important? There's actually authorizing legislation that essentially mandates this initiative. It's Title 17, the Public Health Act. And really, the Office of Disease Prevention and Health Promotion, they're the office that really houses or actually implements this particular initiative. And the act itself talks about formulating national goals and strategies to achieve the goals, but also coordinating activities related to disease prevention and health promotion, coordinate activities in the private sector, establish a national health information clearinghouse, and really that's where we actually store the data and monitor it over the decade. and then support projects and conduct research and dissemination of information. So as I mentioned earlier, this is actually the 5th iteration, but just in terms of context, to kind of give you just a general picture of how Healthy People has evolved. This represents 4 decades of Healthy People, and you can see from 1990, it started off with pretty concise goals in terms of decreasing mortality and increasing independence among older adults. We had 15 topic areas at that time and only 226 objectives. And then moving on to 2000, still some of the same themes in terms of increasing the lifespan. And then the whole concept of reducing disparities became a very pivotal focal point for Healthy People 2000. And then achieving access to preventive services for all. And you can see that the number of topic areas increased at this point to 22, and the number of objectives did as well, with 319. And then Healthy People 2010, continuation of increasing quality of life over the entire lifespan, and then eliminating health disparities once again. And this is where they introduced the concept of the leading health indicators. During the 2010 initiative, there were 10 topics with 22 indicators. And then there were 28 topic areas, and then we jumped quite a bit, almost threefold to over roughly 1,000 objectives. And then currently we're in the process of closing out Healthy People 2020. And then this is where we really begin to look at not only reducing health disparities, but achieving health equity, and then introducing the goals of creating social and physical environments that promote good health, and still maintain that concept of promoting healthy life throughout the lifespan. There were 12 leading health indicators with 26 indicators, and then 42 topic areas, and over 1,200 objectives. And I'll talk about a little bit later that with this iteration of Healthy People, this was the first time that oral health was included as a leading health indicator. So to get a little bit more into the history of Healthy People, and in particular the oral health objectives in terms of number, in 1979, the Surgeon General's report focused on Healthy People, the Surgeon General's report on health promotion and disease prevention. At that time, the Surgeon General was Dr. Julius Richmond, who was actually a pediatrician by training. And he kind of set the stage for which would lead to a document that was led out by Dr. Michael McGinnis, Healthy People 1990. And at this point, there were 12 objectives related to oral health. And then you can see our numbers increased over time with Healthy People 2000, 2010, and then 2020, going from 43 to 26 objectives, and then back down, or back up rather, to 33 objectives. And currently for Healthy People 2030, the proposed objectives are at 11. And a little bit later on in the presentation, I'll kind of go over what some of the background was in terms of this reduction. And I also want to take the opportunity, because I told him I was going to do this, to acknowledge Dr. Myron Alukian, because he was at the right place at the right time to say, okay, this initiative looks pretty good, but what about oral health? And anybody that knows Dr. Alukian, he never gives up. So he is one of the people that you will meet and you'll never forget him. But he played a very instrumental role in bringing that to the attention of people in federal government that, hey, don't forget about oral health. And even at that time, it was the language of oral health is important to overall health. So as I mentioned in the beginning, the data sources with respect to Healthy People 2020, we have 8 data sources for Healthy People at this particular point. And this is really just trying to show just the amount of time and effort that goes into managing this volume of data. NCHS actually serves as the statistical advisor to the Office of the Secretary. and working alongside ODPHP to really develop the initiative in terms of goals and the framework, and then NCHS really manages the data. And so this kind of gives you just a picture of the fact that we have 18 objectives that come from the National Health and Nutrition Examination Survey. 6 were from ASTDD State Synopsis. And then the School-Based Health Alliance was used as a data source. MEPS, the Uniform Data System, which is overseen by HRSA, Cancer Registry data, Indian Health Service data, and then the Water Fluoridation Reporting System. So this is just really to bring your attention to the number of objectives, and I'll get into a little bit more detail to kind of get into more explanation of why some of the data sources are no longer going to be used for Healthy People 2030. So this is a project that's really kind of near and dear to my heart. Anybody that really knows me really well, I love data. I mean, I will talk about it all the time if you let me. So these are the mobile examination centers that go around the United States and collect data for not only just oral health, but many areas, in terms of diabetes, heart disease, BMI, you name it. They collect pretty much a very comprehensive spectrum of clinical data. They also have a questionnaire, self-report measures, and then there's also a laboratory component as well. And just to kind of give you an idea of the time that's committed into actually going out to each stand and collecting the information, they're really committing to 48 weeks out in the field. So it's an ongoing process. Every year in January, they have a big meeting to kind of go over just issues with the survey, what's going to be new for the survey, and then just to get just general training. So it's a big, big operation, and I've had the opportunity to actually meet the examiners on a regular basis, and at this current point, we have 4 dentists that actually work on the survey and have committed their time, and I have to say that I've never really seen that level of commitment. I don't know if I could quite do going from city to city 48 weeks out of the year. That's a tremendous amount of commitment to the survey, and typically this data is collected in 2-year data cycle increments. So just moving on to the Healthy People 2020 objectives, we have them categorized by 5 different areas. First, we have oral health of children and adolescents, and there are 2 objectives in this category focused on caries experience and untreated dental decay. And here for 2020, we have them broken out by 3 to 5, 6 to 9, and 13 to 15 years of age. And one of the things that we had to do, which I'll get into in a little bit more detail, is for Healthy People 2030, we had to end up reducing the number of objectives we had by 50 to 75% roughly. And one of the ways that we were able to do that was really just consolidating the objectives to focus over, from 3 to 19 as opposed to 3 to 5, 6 to 9, and 13 to 15. The next category is oral health of adults. We look at untreated dental decay, no permanent tooth loss, periodontitis among adults, oral and pharyngeal cancer, early detection, access to preventive services, including oral health care system use, which is essentially dental visits in the past year, dental service use among low-income children 2 to 18, school-based health centers with an oral health component, health centers with an oral health component, and oral health services received at health centers. And finally, in terms of oral health interventions, we look at a couple of areas with dental sealants, 3 to 5, 6 to 9, and 13 to 15, community water fluoridation, and preventive dental screening and counseling. This particular objective focused on tobacco cessation, oral cancer screening, and diabetes self-management. We also have two objectives related to monitoring surveillance systems, one for recording cleft lip and cleft palate, and also referral mechanisms for that, and the oral and craniofacial health surveillance, and that's state-based surveillance systems. And then last but not least, public health infrastructures, health agencies with a dental professional directing their dental program. And I mentioned earlier that the leading health indicator actually included oral health. At the time that Healthy People 2020 was being developed, Dr. Howard Koh played a really pretty aggressive role in really saying, hey, we need to include oral health. One of his goals, because he was quite passionate about oral health, was to give oral health more visibility. And that visibility was not just only in federal government, but also outside of federal government. So the indicator that we monitored for Healthy People for the leading health indicator was dental visits in the past year. I get questioned a lot of times about why this particular objective and not some other objective. And believe me, myself along with the co-leads, we really pushed to actually get several indicators. Because you notice here, there's 12 leading health indicators, and there's 20 or 12 topics and 26 indicators. So most of those other leading health indicators actually have 2 or 3 objectives that they monitor, and oral health only got 1. And a part of that is at that particular time, there was a big push to have data that was available annually. And with surveys like NHANES, it's just not feasible. It takes 2 years to actually get adequate sample size and really make sure you're getting a representative sample of the United States. However, we're very fortunate to have oral health among the leading health indicators, and one of the ways that they promoted the leading health indicators was to actually have a webinar. We alternated between having a webinar each year that focused on what people were doing at the community level. So it wasn't always just, what is federal government doing, but we looked at, what state programs were doing, always kind of looking for success stories that we could highlight in terms of how they were utilizing the Healthy People objectives. There was also a Healthy People law and policy report, and it's the role of law in increasing the use of oral health services. The authors were Dr. Bert Edelstein, Dr. Jane Perkins, and Dr. Clemencia Vargas. But there were also a number of people that worked to help to facilitate that effort, and that report should be coming out very soon. But it was funded in part by the Robert Wood Johnson Foundation, just as a way to kind of look at the influence of policy in terms of really pushing to get specific objectives, really all of the objectives to move towards their 2020 target. Finally, this is where I'll kind of get into a little bit about the reduction in the number of objectives. You see here, we went from having 8 data sources to actually going down to 5, and then 11 objectives. As most of you know, that in government things fluctuate, and depending on the political climate, there's a lot of reductions that are made in terms of programs, and this has actually impacted Healthy People. It takes a lot to manage over 1,200 objectives in terms of the staff. One of the things that was in a way fortunate for oral health is that we didn't rely on NCHS to do our analytical work. We did it all internally. So most of the work was done at CDC Division of Oral Health, or we got data from the Division of Cancer Prevention and Control to analyze the data related to the oral cancer objective. And this had been going on for some time in terms of the resource intensive work that was put into Healthy People. with Healthy People 2020, the whole idea was make it more web-based so that we could update with emerging issues or changes and that type of thing. But what they underestimated was the level of resources that would still need to go into that. And really the bottom line, it came down to money. And so that was one of the big reasons for the reduction of the objectives. And what, unfortunately, it kind of took away from the fact that we would work with other topic areas. Like for diabetes, we had an objective there for 2020, and prior to that, that focused on individuals with diabetes that had a dental visit in the past year. Well, because all of the topic areas were given this mandate to actually reduce the number of objectives, well, the oral health one in particular was dropped from diabetes, which is really unfortunate, and especially when I think about all the effort that's, the synergy around medical dental integration, it's kind of hard for me to kind of grasp that. And then too, for oral health, we did a partnership with the oral cancer, or the cancer topic area. So they had an objective within their topic area that focused on oral pharyngeal death rates. And so that obviously was dropped, one of the objectives that was dropped as well. What the topic area for oral health tried to do is we were determined to try to get some objectives that were related to other topic areas. And so we pushed really hard to maintain the objectives on tobacco cessation and oral cancer screening, as well as diabetes management. However, we were told that, well, that's related too much to the other topic areas, and so we had to make a tough choice with respect to, continuing to have that objective in Healthy People 2030. So we had to really make some really tough decisions about it. And one of the things that was different with Healthy People 2030 is the fact that because of limited resources, they didn't go around the United States to get public comment like they did with Healthy People 2020. And so that kind of put things at a disadvantage in terms of getting the public's feedback. I mean, pretty much you had to write a letter or you had to email or do something. There were some online submissions you could do, but everything was a short turnaround time, or it was done over like a Christmas holiday and a lot of people didn't know about it. And the reality is that they were really on the fast track because of the current political environment. They wanted to get these objectives launched as quickly as possible. And I'll talk a little bit more about that later. So this is the list of the proposed Healthy People 2030 oral health objectives. I say they're proposed only because they haven't been launched yet. We didn't get necessarily a lot of feedback about issues with the objectives, but we did get feedback in terms of, oh, why are they dropping, the diabetes objective, the oral cancer death rates? How come we're not still monitoring tobacco cessation and such? So that was kind of the line of, questions that we got. There's still a lot of things that have not been worked out with respect to Healthy People. In particular, the way the data is going to be displayed. It's going to be really interesting how they end up working that out in terms of the data display. Because for us, having objectives like for untreated decay or dental caries experience, when we're looking at children from 3 to 19, irrespective of whether or not they have primary teeth or mixed dentition or permanent dentition, it really doesn't make a lot of sense in terms of the way we apply our interventions. So we're still working with ODPHP and NCHS to really determine how can we still showcase that data, even though it's technically not an objective, but to break it out in the age groups that we really desire it to be in. So that's one of the outstanding issues with respect to Healthy People 2030. So moving on to the particular goals for Healthy People 2030, I highlighted in yellow just the whole concept of the eliminate health disparities and achieving health equity, creating social, physical, and economic environments that promote attaining full potential for health and well-being for all. These are just some of the reoccurring themes and how they've evolved over time, and they're carrying over into the 5th iteration of Healthy People. I do want to mention that all of this isn't done internally in terms of with just federal people involved. ODPHP puts out a federal registry notice to solicit nominations for the Secretary's Advisory Committee. And we're fortunate this time that actually the co-chair for this committee is Dr. Deshanka Kleiman. And I think most people in this room kind of know her background, but she's a dentist by training and also a former deputy director for NIDCR, among other things that she's currently doing at the University of Maryland. So she's played a really critical role and has been very supportive of me and the co-leads in terms of trying to bring more attention to healthy people, because your times have really changed in terms of resources, and that's played a major impact on just really being able to work with individuals like you that are very passionate about oral health or are at the state and local levels that are really trying to leverage as much as you can with respect to oral health. And really the only national data that we have is really from NHANES. So, you know, we're really, the co-leads and we're really trying to figure out ways that we can help to really push for Healthy People 2030 by working with certain national organizations to kind of get them to adopt certain objectives. Just any way that we can help people to really get excited about Healthy People 2030, even with the reduction of the number of objectives. Another critical area for Healthy People 2020 and 2030 were the definitions as it relates to health equity and disparities. Health equity is defined by the HHS Office of Minority Health as attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. The Office of Minority Health further defines health disparities as a particular type of health difference that is closely linked with social or economic disadvantage. Health disparities adversely affects groups of people who have systematically experienced greater social and or economic obstacles to health and or a clean environment based on their racial or ethnic group, religion, social economic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation, geographic location, or other characteristics historically linked to discrimination or exclusion. There were many other definitions that were looked at. This is just a snapshot of just a few. So I'm going to move on to the social determinants of health. This was one of the topic areas that was added for Healthy People 2020. The goal was to create social and physical environments that promote good health for all. The co-lead agencies were CDC, HRSA, NIH, and the Office of the Assistant Secretary for Health. And the Foundation for Inclusion, which we've already heard quite a bit about during this meeting, is the emphasis that was shared by the World Health Organization, whose Commission on Social Determinants of Health in 2008 published the report, Closing the Gap in a Generation, Health Equity Through Action on Social Determinants of Health. This emphasis is also shared by U.S. health initiatives such as the National Partnership for Action to End Health Disparities and the National Prevention and Health Promotion Strategy. This is just a place-based framework that was utilized by Healthy People, outlining the key elements or determinants as it relates to social determinants of health, and really talking about the impact of place on health, the fundamental to the social determinants of health, including social and physical determinants. In terms of social determinants of health, one of the things that Healthy People really tried to push to accomplish with 2020 in particular was to look at data sources that include some of these determinants listed, and I'm not going to go through all of those. And then also for the physical determinants, looking, primarily at the environment. And I think one of the critical challenges for this topic area is that the majority of their objectives that they had for Healthy People 2020, they had no data for them. So they spent most of the decade trying to identify sustainable data sources where they could collect some of this information. So this was a really major challenge for this particular topic area. However, a lot of effort was made to try to identify, what could be potential, what might be ready by the end of the decade. So unfortunately, it was very extremely challenging. And they did have, if you go to the Healthy People website, under the social determinants of health, the objectives, they have quite a few objectives that are actually in other topic areas that they highlight, kind of falling in line with this particular topic area. So here's the list of the proposed Healthy People 2030 social determinants of health. Right now they have 6 objectives, and one of the things that was really pushed for Healthy People 2030 is that you could not include an objective where you didn't have baseline data and a viable data source. So when I highlighted earlier about some of the data sources that are no longer used, like the ASTDD state synopsis, a lot of that was because that NCHS had a specific set of data sources that they used or that they considered as vetted data sources. And a lot of times it would come down to how consistent the data was going to be collected. Did they have a viable data source? So it might not be anything about the quality of the data, but it's just if they were kind of concerned about the longevity or a certain data source using multiple sources to actually provide estimates, they had some concerns about that. So just to kind of quickly go through some of these objectives, the first one is to increase the proportion of children living with at least one parent employed year-round full-time. Increase of the proportion of high school completers who enrolled in college the October immediately after graduating high school. Reduce the proportion of persons living in poverty. Reduce the proportion of families that spend more than 30% of income on housing. Reduce the proportion of children who have ever experienced a parent who has served time in jail, and then increase employment among the working age population. They also have one research objective, which goes to the point about having data where you can really make these connections with social determinants of health. And this one is to increase the proportion of federal data sources that collect country of birth as a variable. This has been, like I said, very challenging to make those connections and have data, because pretty much if the data's not there, it's almost as if the problem doesn't exist. And we all know that that's not true. And a lot of times with surveillance, we're collecting surveillance data to stimulate thoughts in terms of research. It's not viable or resource smart to really collect really extensive data at the state and local level. So, our partners really look at the national level for us to, provide some really good data that they can use to advocate for their programs, to support what they are collecting, even though there might not, the two indicators might not be exactly alike, but just to try to use the national data as a comparison to what they're doing at the state and local level. And one of the things that Dr. Capelli alluded to is that when I have extra time, I'm also the director for the CDC Dental Public Health Residency Program, and that is what I'm really very passionate about. I know it was mentioned during this meeting, the fact of, how we train others to kind of take our place to sustain the workforce. I'm really happy that today, I'm in the position to be able to mentor and kind of give back because I too myself was mentored, and some of you have in the room have played a role in terms of my passion for dental public health. Some of you may not even be aware of it, but you have played a role. So Dr. Jorge Burnell, he's sitting right there. He is our current CDC dental public health resident. He's part-time. The other 20 hours a week, if not more, because he works really hard. He serves as a state dental coordinator and a health education specialist. And what they're required to do in the dental public health residency program is to identify a project that they would like to work on that would serve as their data or main project. But to actually take the board, you need to have two projects. And we're actually in the process of really mapping that out for him, because one of my goals is to try to get as many people as possible, at least those that come through the CDC Dental Public Health Residency Program, to get those two projects, make sure that I mentor them and give it 100%, because that's what I want them to do, is to sit for that board. So I'm not really satisfied until they've sat for it, they've passed, and they're good to go. And my hope is that they will give back to someone else and do the same thing that I'm trying to do. So his research question, as it relates to dental sealant programs in the state of Georgia, are counties with the higher risk of dental caries the most likely to have access to dental safety net programs? I only bring this project up is because I'm always trying to think, you see a lot of descriptive reports, and it always talks about, 50% of individuals of such and such age group don't have this or that, or whatever the number is. You can fill in the blank. But a lot of times, as I've worked over a period of years, I'm always looking for, so what does that really mean? And so I'm really happy that Dr. Burnell is really wanting to kind of examine just how the dental sealant programs have evolved over time, because he actually noticed a dip in the number of state-supported dental sealant programs in about 2014. And then now they've kind of slowly gone back up. But it stimulated his thinking, what else could be contributing to that? I mean, in the state of Georgia, there's 159 counties. So when you can imagine that you might have started off with roughly maybe 71 dental sealant programs, and then you went down to roughly 21 or so, what kind of impact does that have? But then also, are these programs really reaching the individuals that they need to reach? Most programs are placed in a school based on free and reduced lunch, but there's a lot of variation in that number. I mean, that particular school could have quite a substantial number of individuals on free and reduced lunch, but the percentage could also be a lot lower. But they really provide the sealants, to everyone at that school. And then even just getting into the school can be challenging. And especially for Georgia, they have a lot of competition with other organizations that have mobile dentistry units, and they're not necessarily focused on prevention, but really restorative care and that type of thing. And a lot of times the schools don't want, multiple groups coming in and disrupting the classroom time. So his project really is going to focus on taking multiple data sources, exploring GIS mapping to really tease out what is the average time that it takes an individual in a county to actually get to a dentist, using the safety net or the dental sealant programs as kind of the focal point in terms of access to preventive care. What is the pediatric dental capacity? And essentially just mapping high-risk counties and the actual areas that are served so that more effort could be placed on getting these programs in the schools that really need them to the individuals that would benefit the most. So what's coming next for Healthy People? As I mentioned earlier, the launch of Healthy People 2030 is March 31st, 2020. There's also going to be a National Oral Health Conference session. I want to just thank Dr. Dashanka Kleinman and actually Dr. Francis Kim for their effort in helping to support that. And Dr. Myron Alukian will be one of the speakers along with Mary Foley and Dr. Timothy Ricks, or Rear Admiral Timothy Ricks, who's the Chief Dental Officer for the U.S. Public Health Service, will kind of set the stage for that particular session. And I also wanted to mention to this group that this current Surgeon General, for those that don't know, he commissioned a Surgeon General's report on oral health last year. The second that will have been done in 20 years. NIDCR is the sponsoring agency for that. But I can just really tell by meeting Vice Admiral Adams, he's very, very passionate about oral health. And I don't know, some of you may have gone to the Surgeon General listening session where it was kind of launched, the effort for the Surgeon General's report on oral health. He's continued to show a lot of commitment, and actually we had the opportunity to meet with him, one of the few divisions in CDC's Chronic Center that met with him last month, and he expressed again wanting to promote oral health as much as possible, and wanted us to send, whatever we could, and he would promote it through any kind of way possible. So we have a lot of opportunities in oral health, and I think this is a time that, this year in particular, we have a report that's to be, released later in the year. We have a lot of different initiatives going on, and we can use those definitely as synergy. In terms of the leading health indicator, right now they haven't finalized the list of those, so I'm not really sure if oral health is going to necessarily be included, but I'm hopeful, and it's planned that probably next year, 2021, they'll actually launch those indicators, so there's more to come with respect to that. And then finally, just stay connected. I would encourage you, feel free to reach out to me. My email is on the actually on the last slide, but there's a lot of ways you can stay connected in terms of web, email, Twitter, YouTube, and so on and so forth. But just, stay involved, because we're really counting. We don't want to just have these objectives and just monitor them as a basic exercise. We really want to have you all engaged, and we want to be highlighting what you're doing with respect to the Healthy People objectives. So I encourage you, if any of you are working on something that aligns with any of the objectives, please reach out to me, because I would definitely like to hear about it. I would definitely like to promote it, and that's one of the things that as a topic area we're trying to really do, is try to line up how we can showcase what people are doing out in the field with respect to healthy people. And that's about it for me, but please, my email is on this last slide. Please do reach out. I want to hear from you. I want to, it could be anything really. If there's something that I presented that you weren't clear about, or if you just had any general questions, if I don't know, I'll put you in contact with the individuals that may know. So thank you so much for your time and attention.
Or? Anyway, this is kind of a plug, really. I just wanted to share that it kind of fits in with a lot of what we've talked about in the last day or so. The ASTDD Best Practices Committee, we have a dental public health resident in the room, actually, Arielle Franklin, who will be our primary author on a new best practice approach report we're working on data dissemination. And the reason we decided to do that is that many people are collecting all this data And we really wanted to start the conversation about how that data is shared so that we can use it for this policy and advocacy that we've been discussing. So I just wanted to that's kind of like my trailer for the coming soon. I mean, it'll be probably a year or so because Ariel's also she's working full-time and a part-time resident, so she's really, so if she would like to stand up just so we can introduce her. Thank you, Ariel, for volunteering to work with us on this. I think it'll be a really great project to hear about down the road, so I wanted to share that. So hopefully it'll be helpful as we all move forward with the things we've been talking about.
Yeah, no, I think that's really great because one of the things that I have another resident doing is, like I was saying with the data, sometimes we look at it from a purely descriptive perspective. But one of the things that we saw with some recent NHANES data is that the prevalence overall of dental sealants has definitely increased. But when you look at it by race, ethnicity, it's kind of interesting because you kind of wonder, what's influencing that? Is that some type of policy or initiative that maybe could be contributed to that? We saw some really good increases, especially among Mexican Americans in terms of prevalence, actually surpassing non-Hispanic whites. However, for non-Hispanic Black, there were still disparities that persisted. So the other resident that I have, that's what she's looking at. What could be potentially some policy or other issues that may be going on, perhaps health literacy or something like that that might be influencing that. But, that's where we need to really dig deeper, and we need to make the data meaningful for you all that are working out in the field.
Thank you, Gina, for a very interesting description. I'm teaching healthy people to the dental students, so you filled in a lot of blanks for me in this presentation. That was great. One thing that I've always had difficulty explaining is how dental visits is a leading indicator for oral health. And that's, I mean, this is just one of these strange things that seem to have happened in backroom discussions.
Yeah, I get that a lot. So I even mentioned it during the presentation. And for those that don't know, the dental visit question, it's on the medical expenditure panel survey, or MEPS. And one of the challenges that we had, although we wanted to really include like untreated dental decay and, maybe dental sealants and, one other one, there was really, I'm not really sure, because sometimes a lot of this stuff is really political, unfortunately. And what I could gather from just kind of exploring, why did they end up picking dental visits, was that data for MEPS is available every year. So even though it's not necessarily current data, like right now, the most current estimate we have is from 2017, because there's a new estimate every year. That was kind of the selling point. And at that time, the powers that be, the focus was getting data out very quickly. And because they were going to be highlighting a different leading health indicator every month, they wanted to be able to showcase something different, every year throughout the decade. So the short story to a longer story, that's what it came down to, and which is really unfortunate. Because I keep asking, why do we only get one objective and all the other leading health indicators have several? I couldn't get past that, so never mind the dental visit one. It was, why can't we have more objectives to highlight like the other leading health indicators? So I hear you. Are there any other questions or anything at all?
Thank you very much.
Okay.